Hi guys, it's been a little over 3 weeks now since my surgery. My ACDF and the posterior um, surgery that I had, cervical surgery. It's been rough, especially because I have problems with the medication for the pain. I have some side effects, and so I wasn't able to take the very potent Oxy. I took Percocet, which was a little lower, so I did have some breakthrough with pain, and I still had some side effects on the Percocet, but not as bad as I usually have with the plain Oxy. Um, the main side effect is I think it's called Nostrabus. It's where my eyes dance and I'm a little bit dizzy, and I actually have to keep my eyes closed the majority of the time. Um, I've been doing my exercises, keeping everything moving, my yes and no, and my stretch is over. So I've been doing my little exercises. Yesterday was a horrible day for me because I've been using ice packs on my neck and my back, and apparently, after taking the ice pack out, my grandson helped me, and I guess we didn't tighten this enough. My neck was wobbly, and I went to sleep, and I guess my neck moved a little bit around. And when I woke up, I was in just awful pain. I couldn't understand why, and I mean, pain where I was in tears. And even just trying to get up was painful. And then later on, I realized that my neck brace was very loose and my neck was moving around. So I tightened it extremely tight, and that has eased up the movement and eased up the pain. So I'm just hoping that nothing went wrong when I slept and my neck was just kind of moving around, because I'm still having pain, but it's kind of easing out. So as I was mentioning, one of the things that I got to make this journey a little bit easier is because I watched YouTube, and they stated that they needed a zero gravity chair. So this is what I got, a zero gravity chair. And has been my bed for the entire time. I have not got into my own bed because just the turning and the sitting up, this one works for me. This is another thing that you're definitely going to need. I use this sometimes to cushion the back of my neck. And I will get into my chair and I can sit and I can actually lay back. And this is how I sleep. And sometimes I might just make myself a little comfortable, legs up, so this is how I sleep, and this has worked for me. And I'm so glad I watched YouTube to realize that I needed a zero gravity chair, I needed a neck pillow. Definitely cups with straws to drink. That's the other thing that's necessary. And with this chair, as I said, I can lay back and sleep, and then I can actually sit myself back up by tilting. It doesn't put any pressure on my body trying to sit up. And then so I tilt and sit back up straight, and I kind of push it on, scoop myself down to the edge and push myself up. So that works. So it's a long process. My doctor wants me to keep this on for 3 months. No driving. And so that's what I have to do. I gotta keep doing my exercises. So that's what's going on. So I just wanted you to all know that anybody who is gonna look for videos about this surgery, hopefully this will help you to know what you need to get, how you're gonna feel, what goes on. I did have a little issue with my surgery where I ended up getting my spinal canal pierced, the dura, and leaked spinal fluid. However, they were able to patch it, glue it, kept me for some extra days in the ICU, and everything is good. Thank God, because I prayed that everything would go successful and everything would work to God's glory. So I'll talk with you again as I make more progress. Take care.